Since Wuhan, COVID-19 cases have spread all over the world, and at an impressive rate that is still unknown, making it the de facto pandemic of 2019 and 2020. Aside from the fact that the virus is getting defeated in China, due to the almost draconian measures imposed by the government in all its major cities, now the epicenter appears to have moved into another location. This time is not Asia, but Europe. So the real question here is, for how long? The vast majority of developed countries are studying and discussing the real advantages of a national lockdown against a pandemic like this one. The agglomeration of crowds, international travel, and the unpreparedness of our health systems are some of the most obvious factors that can lead to a devastating scenario. And yes, coronavirus doesn't mean instant death, but when you take into account the economic impact, the high risk on the elderly population, and the logistics involved, you can see how easy it is to destabilize our modern society. At this very moment, and outside of China, Italy is the country that has experienced the widespread consequences of this modern phenomenon. We're talking about a forced lockdown, general quarantine, prohibition of commercial flights, a work-from-home mandate, and disturbing scenarios in which families have lost relatives in the most unthinkable conditions. We would like to take this brief moment to send our best wishes and support to all of our fans in Italy. Most of us know that some countries are more prepared than others when talking about this issue. There are nations with strong healthcare systems, outstanding personnel, and quick plans of action, but this is not the case for everyone. You might live in a region that is at serious risk right now, and probably you're not aware of that fact. That's why we've made this video, with the sole intention to clear any doubts once and for all so you can stay prepared. While Europe has been the new epicenter of COVID-19 cases for the past 2 weeks, our research shows that some regions are at a maximum alert due to the tremendous risk that this pandemic represents. On the other hand, it's safe to say that our modern society is more prepared than ever. In fact, the Nuclear Threat Initiative Project, with the help of the Bill and Melinda Gates Foundation, have released this fully comprehensive report called the Global Health Security Index, which is free and totally accessible for anyone who wants to download it. You can find it in the link in the description. In that assessment, an outstanding panel of renowned experts in areas like epidemiology, vaccine development, and biotechnology, to name a few, have been consulted, and their findings are remarkable. This is one of the most striking conclusions you can find in the report. Infectious diseases know no borders. All countries must prioritize and exercise the capabilities required to prevent, detect, and rapidly respond to public health emergencies. Every country also must be transparent about its capabilities to assure neighbors can stop an outbreak from becoming an international catastrophe. In turn, global leaders and international organizations bear a collective responsibility for developing and maintaining robust global capability to counter infectious disease threats. So let's talk about the criteria behind this 324-page study. In that way, we'll have a solid foundation of facts that can help us understand much better the whole situation. Here we go. Number 1, prevention. Deterring the release of pathogens, all in regards to antimicrobial resistance, zoonotic disease, biosecurity, immunization, and more. Number 2, detection. Early reporting for epidemics of great potential. In other words, laboratory systems, real-time surveillance, epidemiology workforce, and more. Number 3, rapid response. Reaction and mitigation of the pandemic in effective ways. Number 4, health systems. Sufficient and robust health platforms to treat the sick and protect workers. Number 5, compliance with international norms. The commitment to improve national capacity, financing plans to address gaps, and adhering to global norms. Number 6, risk environment. The grade of vulnerability of a country in regards to biological threats. According to the Global Health Security Index, at least 75% of countries received a low score on globally catastrophic biological risk-related indicators. Now, which were the countries that performed better? Good question, and the results may impress you on some level. That's a privileged list, but we also need to talk about the worst performing countries in that scientific paper, the ones that are at a maximum risk. The results are worrying. By making this video, the team at Infographics Journalist wants to provide the most accurate information to all our followers. In times of desperation, only the truth can take us forward. Stay safe and be sure to follow all the guidelines the experts are sharing with us. Don't forget to click the subscribe button, and if you liked this video, give it a thumbs up. That will help us a lot in making more insightful videos like this one.